Hi, it's Dr. Joe Magnant back again with our vein specialist Q&A. There's a few other questions I wanted to answer. One of our patients asked the other day whether or not venous disease or vein disease, varicose veins, should be fixed or looked into before their total knee replacement or total joint replacement. And it's a great question because we see a lot of patients who have had orthopedic surgery or are planning on having orthopedic surgery who have legs that look like this with large varicose veins across the knee. And we know from experience that identifying, investigating, and then treating patients' severe venous disease before a total knee replacement or total hip replacement does enhance their ability to go through rehab by having better range of motion in the joint. It reduces wound sort of healing problems. It reduces the risk of DVT or deep vein thrombosis. So orthopedic surgeons in Southwest Florida are forward-thinking surgeons. We partner with a number of them in terms of pre- and post-operative evaluation of their patients for venous insufficiency, and it's a great partnership.